In this video, you'll learn how to address a blocked-out tooth by directional bonding a Smartwire Locket directly to the tooth surface. When a patient presents with a partially blocked-out tooth, you have three options. You can direct bond a bracket if there's space, you can directional bond the Smartwire Locket directly to the tooth, or you can leave the Smartwire as is and make the patient comfortable. In this video, we discuss directional bonding, where the locket of the Smartwire is positioned and bonded to the surface of the tooth as if it was ligated to a bonded bracket at its planned bracket position. Follow these simple steps to directional bond a Smartwire Locket. After ligating Smartwire 1, isolate the blocked-out tooth and prepare the lingual surface for bonding. Etch, rinse, and dry, then apply primer to the etched surface. Dry the primer and light cure for 5 seconds. Next, guide the locket towards the planned bracket position on the blocked-out tooth. To do this, first apply freeze spray to a Q-tip or the tip of a microbrush, and then press the frozen tip against both IP loops for 5 seconds. The sudden drop in temperature makes that section of the Smartwire soft and easy to position. Do not apply freeze spray directly into the mouth. Once the locket becomes soft, use the tip of the engager to guide the locket towards its planned bracket position. Once you move the locket near the planned bracket position, apply flowable composite in between the locket and the tooth, as well as on top of the core and the neck of the locket, avoiding the IP loops. Perform an initial light cure from about 2 inches away for 10 seconds. Curing from a distance helps avoid heat activation of the Smartwire during the light curing process. Then, bring the curing light slowly towards the locket and perform the final light cure for 5 seconds. When space opens and the tooth is ready to be bonded with a bracket, use a handpiece with a composite burr to carefully remove the flowable composite until only a thin layer of cured material remains. Then use a scaler or lingual Weingart pliers to crack the final layer of composite and gently remove the Smartwire Locket from the tooth. During composite removal with a handpiece, take extra care to position the handpiece correctly to avoid damaging the neck of the locket. Any damage to the neck can make ligation of the locket more difficult. Do not use the scaler or the lingual Weingart at the IP loop area because it can damage the Smartwire. Well, this completes how to directional bond a Smartwire Locket. For more information, check out the blocked out tooth guide and knowledge base on the Smile Design Studio at portal.inbrace.com.